Hello and welcome. This is another episode of Health Huddles, a series hosted by AARP Illinois and dedicated to empowering those that are 50 plus in their health and wellness journey. I'm Lori Hendren. I'm the Senior Associate State Director with AARP Illinois, and we're very excited to have you joining us today. We're going to be talking about empowering seniors and family caregivers with the knowledge and strategies when it comes to keeping prescriptions safe. For all of you that are joining us, I'm sure you've heard this many times, but I'm proud to say AARP is the nation's largest nonprofit, nonpartisan organization who is advocating for what matters most for those of you. So in Illinois, we have 1.7 million members, but across the nation, we have 100 million. And we're talking always about your health security, financial stability, and personal fulfillment. And we're excited to have you here. Today, we are honored to have a very esteemed special guest is Dr. Patrick Harper. He is a licensed pharmacist who works for the CDC, and he is on assignment with the Illinois Department of Public Health. And he is joining us today to guide us on our discussion, to give us insights. And we are honored to have you with us today. Thank you, Dr. Harper. So, all of you that are joining us live, oh, yes, thank you. All of you joining us live, Facebook, YouTube, we want to hear from you. Dr. Harper is here and I to be able to give you the answers that you're looking for. So whether it's a comment, whether it's a question, we're here to be with you. So Dr. Harper, if you're ready, let's get going. So real quick, Dr. Harper, I would love to know a little bit about your background and your expertise.
Yeah, absolutely. I appreciate the opportunity to be here today, Lori. I always like to start to kind of explain my appearance. People wonder if I just parked my ship or my airplane. So in addition to all of the things you mentioned, I'm an officer with the U.S. Public Health Service. So I serve the country under the direction of the Surgeon General. It's through that branch of service that I'm stationed with the CDC. And that's the opportunity that gave me the opportunity to be here with the Illinois Department of Public Health working in chronic disease prevention. So I am a pharmacist by initial training and then have a master's of public health on top of that. I've spent my 15-year career thus far in a variety of pharmacy and public health administration settings. I started my career working on a hospital in the Navajo Nation with the Indian Health Service out in New Mexico. Spent some time caring for federal inmates as the chief pharmacist of a Federal Bureau of Prisons facility. And then also have experience in the private sector with a handful of retail and community pharmacies that are probably more what people think about when they think about traditional pharmacy practice. So excited to bring that experience here and hopefully answer some questions today.
And we appreciate you so much. So we're focusing today talking about prescription drugs, how to keep them safe for family caregivers. That in Illinois, we have 1.3 million unpaid family caregivers that are caring, and now they're all of a sudden juggling, I would say, medication and services to their loved one to keep them home rather than premature nursing home placement or even post hospital stay. So real question right off the bat for you, Dr. Harper. What are the best practices for organizing and tracking multiple medications a senior may have from a caregiver's perspective?
Yeah, a lot of these answers to questions like this, I think, aren't going to be surprising. They're probably things that people have heard over and over and over again, but that doesn't make them static. That just emphasizes their importance. I think the first thing is always having an up-to-date medication list. And I mean that in terms of having a physical list to reference of the multiple medications that you or your loved one are on. This needs to be updated regularly using touch points such as pharmacy visits and doctor's visits and monthly refills of medications as an opportunity to constantly review it and revise it. And having it in multiple places. Technology has made it to where most of us carry a computer in our pocket these days. So having a digital version of the list in addition to written versions of the list stored both with the medications and just handy for reference. I think the medication list is probably where all of this starts. The other things I always advise people to do is one, to use a single pharmacy whenever possible and making it a priority to make it possible. Having all of your medications managed in one place by a single pharmacy gives you a one-stop shop for all of the expertise and guidance resources you need. If I'm your pharmacist and you have medications that aren't housed in my pharmacy, then I have blind spots to your care. And I want to fill those blind spots so that I can help you manage your medications appropriately. And then the last thing is routine. Once you have the med list, once you have your resources in place to manage that med list, it's just a matter of making medication usage a part of your routine so that it becomes an active daily life. And just like brushing your teeth or letting the dog out or getting in bed at night, taking medications at the appropriate time becomes one of those daily actions.
I think this is the interesting part. So there is for an individual, they may have many prescriptions, but how, if you're a caregiver taking care of your mom, they go in and there's concerns about a prescription. Let's see, you saw an ad on TV or you saw a report at 5 o'clock at news. Like, I don't think that. How do you communicate with your healthcare provider your concerns without being too pushy, but always prioritizing the health and the care of your loved one?
Yeah, you communicate openly, honestly, and frequently. And I think it's part of our nature to worry about the too pushy part. I mean, certainly I'm not here to give a course in etiquette. There's an appropriate way to interact with folks. But you have to be an advocate. You have to be an advocate for yourself. You have to be an advocate for the loved one you're caring for. There are individuals in the medical world that make a living as patient advocates. That's their job. That's their role. That's what they get paid to do. That's what your and my role is for the ones that we're caring for, is to be that advocate. So there is no question too silly. There is no question that can be asked too many times. My advice would be is if you have a concern or a question, ask it, because my point of view as a pharmacist and as a medical professional more broadly is that's what I'm here for. That's why I went into this line of work. Sure, there are stressful days at the pharmacy. There are stressful days at the doctor's office where you're juggling a lot of patients at one time, and it may seem like it's hard to penetrate that frustration, but I would just encourage patients and caregivers to do so. There are a number of messaging channels that can be used these days to contact your provider. You can contact the pharmacist. You can contact the doctor's office directly. In many cases, you can do that via phone and email. Many have apps now, going back to that computer in our pocket. I know if I need to have a conversation with my doctor, I can use a message board through an app that sends them messages. Now, I might not get a direct response. It might be 24 or 48 hours, but I think for a lot of these medication concern questions, that's an appropriate turnaround time. If it's something more urgent than that, now you're looking at making an appointment, using 911, going to the hospital, whatever the case may be. But if it's the type of question that you just described, I would say use all the resources available to you and communicate that with them through the variety of channels that are available out there.
That's wonderful. Thank you, Dr. Herbert. I really like the empowering words you have for listeners that you can ask the questions. This is your health. You have every right, and empower you to take charge. I love that. So let's go to our next question we have. What are the key elements for seniors and their caregivers to look for on prescription labels to ensure correct usage, right? There's some that have to be refrigerated, some that have to be at, room temperature, some you have to take with water. Sometimes it's overwhelming. So what do we do and where do we go?
Yeah. So I'll give you a mini course in pharmacy practice right now, and talk about the 5 rights. And I think
Okay.
the first thing to think about when you get a new medication, when you get a refill of an existing medication, think about the same things that I think about when I'm filling a prescription, and that's the 5 rights. Is it the right patient? Look at the label. Is this medication for you or your loved one? That's the first error we want to avoid, is a confusion of dispensing to the wrong patient. Second is this the right drug? Is this the medication you were expecting? Excuse me, if it's a refill, is it the same medication as last time? That goes into, is it the right dose? Is it the same strength as you were expecting? Is it the same strength as you were taking last time? And if not, were you expecting a change in that dose, right? So you want to make sure it's for you or your loved one, it's the right medication, it's the right dose. Then, is it listed to be taken at the right time? If this is a medicine you're used to taking once a day, does the label have clear instructions that you're to take it once a day? Or has that frequency changed? And if that change occurred, were you expecting it, right?
Mhm.
And then finally, the right route. Is this a patient? Is this a drug you used to wear as a patch, but now you suddenly have
Mm.
pills in your hand? We need to be aware of that. Is this a drug that you previously injected and it didn't require refrigeration, but now it has a sticker on it that says to refrigerate? We need to know about that. The last thing, I think, going back to, is it that right drug? Many, if not all, prescription labeling software programs will put a description of the pill or the device on the medication label itself. So when you get a label on your vial from the pharmacy, it will probably have a little section on the side of the label that says round white tablet W
Mhm.
on one side, 46 on the other. Always compare that to what's in your container, and make sure that the medication looks not only as you expect it to, but as the label says it should look. And if you see a discrepancy there, reach out to your pharmacy and clarify that discrepancy. I think those are the big things. In terms of the finer uh, navigation points of taking medication, whether it be over the counter or prescription, and the things you mentioned, like side effects, when to take it
Mhm.
with, empty stomach, water, morning, evening.
Yeah.
Um, I I have a feeling our conversation will go into some of those details as we progress
Mm.
here, but um, that comes down to a matter of reading. Pharmacists are going to counsel you on new medications anytime you pick one up, but that's a limited period of time. It really falls to the caregiver and or the patient to read the literature that's given with the prescriptions and identify what questions you might have related to those specific instructions, on how best to take the medicine safely and effectively.
So we're talking about caregivers. I go back to next question. What strategies can be given to ensure seniors take their medication at the right time and the dosage, whether it's every day or every week? What is some practical advice for someone who is juggling the world as a family caregiver, right? Their own family, their own job, taking care of their mom, all of a sudden managing prescriptions. What's the common sense and how do you balance making sure those medicines because stay right? I remember as a child, my dad drew me a chart. This is why we take medicine at the right time. He was very scientific. He's like, because you want to keep it level because then otherwise you drop. So how do folks handle and manage that?
Yeah, and I will say the fact that they're maybe simple recommendations doesn't mean they're easy to execute. So
Yeah.
let's acknowledge that with one another, is that managing medications is hard.
Mm.
Managing medications for yourself is hard, much less managing them for someone else in addition to all the things that you're juggling for your own life. So while these bullet points might sound easy, I want to acknowledge that this is not an easy task. And that's why I say the best thing you can do is be an advocate for the help you need, the information you need, the resources you need. I think the biggest thing I'd come back to is what I mentioned earlier, and that's routine. Um,
Okay.
Building the administration of medications into the routine of the day, whether that's the caregiver working with the patient or the loved one to establish that routine, helping them develop something that they can execute themselves, or whether a higher level of care is needed where the caregiver actually has to work into their routine, being present for
Mhm.
medication administration. But building it into the routine of the day makes it just something that over time will occur more naturally. So I think that's the first thing. Outside of that, I like to push people to rely on technology and memory aids as much as possible. Um, there are a variety of medication dispensing tools available to
Mhm.
you, from the simple daily pill box to really elaborate forms of those same tools that have timers on them. Some of them have time sensitive locks on them to where the medication compartment will only open at a certain time, all the way up to a full blown 10 medication pill dispensing unit that you can sit on your counter and have it dispense pills at the right time of day. Um, I think that whole spectrum of tools is available to people, and it's just a matter of finding that cross section of what works best, what's most affordable, and what's most effective. Going back to technology, though, again, we all have those computers in our pockets. I know technology use is different based on what generation of patient or caregiver we're dealing with, but I think it can be incorporated into all levels, whether it's a simple alarm, a phone alarm,
Oh,
whether it's an app you can download specifically for medication management that allows you to build your medication list in it and set specific timers and reminders related to each of those drugs, sends you text messages, sends you emails, gives you notifications on your device. All of these things exist, and I'd really encourage people to research what's out there and take advantage of what best fits their needs.
mm-hmm. That's wonderful. I think, Dr. Harper, you said something, I had to write it down, building into your routine of the day. Whether it's the memory aid and looking to technology. And technology, like you said, can just be that reminder that you have to take it and your phone rings and you're probably going to be in a restaurant and it's going to ring and you remember to take your meds. But a lot of it, for a lot of us, we all have these phones in our hands with endless capabilities, but you can use it to your advantage. That's wonderful. Thank you. One of the questions we have is also, what is the safest way to store medication to prevent the accidental misuse or ingestion with grandchildren and even our beloved pets?
Yeah, this is a great question. Every October, it's Pharmacist Appreciation Month, and I make a point to try to reach out to a local group that involves children, whether it's scouts or youth groups or something, and I give a presentation called Medicine or Candy? Can you tell the difference? And it's a visual, hands-on, interactive activity where the kids are presented with actual prescription medications safely. I'm controlling them, and candy, M&Ms, Skittles, Mike and Ike's, those sort of things.
Oh,
And they're asked to say which is which. And what's really fun to me about this is I give the same quiz to the adults that are in the room as well, and no one does well. So medication safety and control of those supplies is extremely important to keep them out of the hands of our loved ones or our pets that shouldn't be using them. I think again we want to acknowledge that a lot of these recommendations almost conflict with making it part of our daily routine, because things in our daily routine, we want them to be visible to us, that we want the reminder to always be present in front of us so that it's easy to take action. And now I'm going to tell you to keep your drugs in a place that's away from everything else and not out in the open and difficult to get to, right? So again, it's a balancing act. But I'd say store your medications in a place that is only for medication storage, nothing else. And that reduces the likelihood that someone is going to get into that place looking for something that is not your medication and finding the medication, right? So if you don't want a grandchild rooting around in your medication, keep the medication in a place where the grandchild has no reason to be, or anyone has no reason to be, except for accessing that medication. Keep the medication in its original container when possible. Now, we just talked about using memory aids, using pill containers. So obviously there's going to be times when you can't do that, but at least saving the original medication containers and keeping it in that same dedicated place allows you to access the information of what the pill is. So that way, if you come home and Scruffy has chewed through a pill case and has ingested a lot of medications, you can go back to your stock of original containers and develop a list of what you think he ingested. And that will help you take action. And the last thing is, and this kind of goes back to the dedicated places, keep it out of reach and out of sight. I'm a father. I have 2 young children. I have parents who are on medications. To their dismay, sometimes one of the things I do every time I'm at their house is a visual sweep to make sure there's nothing in my kids' reach.
Absolutely.
My kids are really, really good at knowing what's not theirs is not theirs and not touching it. But medications, and especially medication devices, are kind of alluring to children. So keep it out of reach, keep it out of sight, and that lessens the opportunity for a kid to have easy access to it.
That's great. So we do have a question from YouTube. So thank you all for being here with us. There's a question about medication, such as interaction. Is it better to start with a pharmacist or doctors, especially so if you got multiple doctors involved and you have multiple medications? Who's your first person to go to understand about possible interactions?
Yeah, I acknowledge that I am a pharmacist and there's a potential for bias here, but I don't think that's really the case when I say the pharmacist is your best first place to go. And you mentioned the reason why, Laura. You said you may have multiple doctors, and that's absolutely true. Um,
Mhm.
that's why I recommend that you keep a single pharmacy. Because if you have multiple physicians
Mm,
that are prescribing multiple medications, and as much as we like to think we live in a world of coordinated care, and certainly medical professionals do their best, is your endocrinologist really talking to your cardiologist, really
mhm.
talking to your
Sure.
primary care provider? Probably not as frequently as we would like. But if all of those prescriptions from those three offices are going to a single pharmacy with a single pharmacy care team managing them, then you have built into your medical care system a unifying factor, a unifying point of
Mhm.
contact. So that's the first reason I say reach out to your pharmacy, is because they have better visibility on your entire medication profile than your individual prescribers do. And then the
Mhm.
second thing is, you know, we're just the medication experts. If I have a
Mhm.
question about diabetes, I'm going to go to my endocrinologist. If I have a question about heart disease, I'm going to go to my cardiologist. If I have a question about my medications, I'm going to go to my pharmacist, because
Mhm.
that's what that professional has been trained to do.
That's wonderful. It's interesting. Thank you for viewing us on YouTube and that great question. I was just at lunch with someone and they were talking about going to multiple doctors in their health journey and having to bring the paper trail and them not knowing the treatments they were on, and what a challenge that was, how stressful it was being in that health, situation and then having to carry the administrative burden of being your own, secretary of this. So let me follow up with you on this one. We have big chains, right? We have big pharmacy chains that are out there. And I may have the one that I go to all the time, but my specialist, let's say, is in Boston. If I stay with that chain, I guess my information is collected, but it's really best to have the medication brought by my home pharmacy in that chain. Is that right? So the pharmacist knows me, the team knows me, and they know what I've been taking. Is that a right assumption?
So you're talking about being within the same pharmacy corporation versus
Yes.
being at the same physical pharmacy with the same people at it, right?
Hmm.
So yes, I mean, I think technology has created a system, especially among large pharmacy chains, where your data is easily transferable. So if you have a pharmacy in your home state that you go to regularly and you're out on vacation and you go to that same brand of pharmacy, the pharmacist and the pharmacy team, even though they don't know you, are going to be able to pull your information from the system and have access to everything, just the same as if you're at that same branded pharmacy in your hometown. But yes, I do think there is an incredible amount of value to using not only the same branded system, but the same actual physical pharmacy with the same staff members in it. And I say that as one who stood on my side of the counter and knows
Uh-huh.
Mrs. Smith or Mr. Johnson when they walk in every day. If I see him shopping for groceries, I can say he hasn't filled XYZ medication,
Mhm.
and normally this is the time of month that he does that, and he's here now, so maybe I'll go chat with him. That personal touch is certainly important. Now, I think in saying that, we have to acknowledge that because of the way our healthcare system in this country works, many of us are not given a lot of choice on what pharmacy we use. Not only which one, but whether it's an in-person pharmacy versus a mail order pharmacy.
Right.
So it might feel different, but you can access pharmacists and experts through your mail order pharmacy. It's required by law that they provide you with a 24-hour hotline for pharmacist access. And so, again, be your own advocate, be an advocate for your loved one. And if you have that need, even if you're using a non brick and mortar pharmacy, use
Mhm.
the resources that they've provided for you to access that expertise. I will say one last thing, and my pharmacy brethren that work behind the counter will probably sigh at me for this because of those busy days. If you're using a mail order pharmacy, by the requirement of your insurance plan, and you
Mhm.
have questions about medications that you just feel need an in-person consultation, go into a pharmacy in your community that is close to you, that you trust, maybe that a loved one or a friend uses, and ask the pharmacist for help. I can't imagine there's a situation outside of maybe an immediate high volume moment at the pharmacy where they will tell you, no, I can't help you. So again, be an advocate for yourself and for your loved one and seek those resources you need, even if it's not in the conventional way.
No, that's wonderful. That's too many people struggle with, I feel uncomfortable or I don't want to get in their way. And I really like that from your professional experience, encouraging people that it's okay and sometimes even welcome because that's what you're trained to do and you're passionate about doing. So that's wonderful. We have another YouTube viewer has a question. It's regarding the timing of pills that you have to do twice a day. Um, is there a certain time if you have to take a pill twice a day? Is there a standard protocol, like you should do it at 8 AM and 4 PM? Or if you sleep into 10, do you do it every 12 hours? What and I'm sure you're gonna say go back to your pharmacist, but what's your take on this one?
Yeah, so for some medications, there are very specific timing periods. And so there may be medications, and the verbiage is even confusing for pharmacists sometimes. Extended release versus controlled release versus immediate release, and sometimes that means something specific, and sometimes that's an interchangeable term. So yeah, go back to your pharmacist. But for the most part, if a medication has a very specific interval on which it needs to be administered, every 12 hours, every 8 hours, that's going to be incorporated into the instructions with specific intent. So if you have a medication that says take twice a day, I have to say, in general, I can't speak for every medication. I don't know your specific medication list, but in general, you have flexibility of that timing. I would say, for this specific question here, it says the second dose was taken at 4 p.m. Is that too early? Well, it depends on when the first dose was taken, right?
Yeah.
If the first dose was taken at noon, probably too early. If the first dose was taken at 10 a.m., now you're looking at a 6-hour gap. I'd still probably push it if I could. But if that first dose was taken at 6 a.m., now you're looking at a completely appropriate dosing window for a second dose. And so I think it's going to be specific to the medication we're talking about, whether or not it does have a very specific time window for administration, or whether it is a more general twice a day, 3 times a day instruction. And I know that's probably not the level of specificity this viewer is looking for in that answer, but I think that's about the best we can do outside of a direct patient
Right.
consultation.
I think that's and talk to your pharmacist is something we hear because and as a family caregiver, making sure you're listed on the chart so you can have those conversations. We're almost down to our 30 minutes, but I have one more question we got to get in. And I
Yeah.
thank you all for our viewers on Facebook and YouTube. Your questions are why we're here. What steps can be taken to avoid harmful interactions between prescriptions, over-the-counter drugs, and even dietary supplements and vitamins?
That single pharmacy touch point is one of the most vital components of this. Having all of your medications at one place is the key to helping yourself and your loved ones avoid harmful interactions. I will include with that over-the-counter drugs and dietary supplements. All of those things certainly need to be included on the medication list that I've encouraged you to create and maintain. There's no, if you're putting it into your body, there's no such thing as not important, right? So my medication list that I carry personally for myself includes daily multivitamin on it. Now, is there anything in a daily over-the-counter adult multivitamin that is truly concerning in terms of, an immediate effect on my health? Probably not, but it is on my medication list because I want to be sure that if I'm started on a new medication or if a medication is changed, it's accounted for. People often think that dietary supplements, by nature of being over the counter or natural, are a safer alternative to prescription drugs, or maybe don't need to be considered in the same conversation with prescription drugs. I will tell you that is absolutely the opposite. Dietary supplements do need to be considered along with your prescription drugs because the majority of the interactions we see with medications come from over-the-counter drugs and specifically dietary supplements.
Oh.
There are a large number of medications that interact not in a harmful way, but more so in a way that will make the medication less effective with things like calcium and magnesium and potassium. And these vitamins or supplements or minerals that are found in a large number of what you can purchase over the counter. So the more you can keep everything at a single pharmacy location, and the attention you give to including everything you're putting into your body on your medication list, the better off you'll be in avoiding these interactions.
That's wonderful. So we're at our half hour time, and I want to circle back on something you talked about, Dr. Harper, is about having your medication list. You know, for some individuals, writing it down is very challenging. So if you have that one pharmacy, is there sometimes an option you can ask the pharmacist to print out all your medications that are active so you can have it in your car or you can give it to your daughter? Is that an option?
That is absolutely an option. Don't be afraid to ask for that. You know, depending on the relationship you establish with your pharmacy and your pharmacist, it could be something that's automatically included into your bag every time you refill a prescription.
That's a great point.
Absolutely, that's something the pharmacy can produce for you or help you produce. And I would ask questions about even additional resources that your pharmacy may have. I know some of the large corporate pharmacies in the country offer a blister packing system where your medications can be in individual blister packs for dispensing. They'll be in calendar dated strip packs where each packet has a date on it and you know that's when to take it. There are all kinds of great resources that your pharmacy might be able to connect you with.
That's wonderful. And our last question that we got from YouTube is, so there's a lot of apps. Everybody knows about apps, right? But is there, through the Association of Pharmacists or through the CDC, or is there a place that we could go to be able to get a good understanding of what's out there in a trusted environment so we're just not downloading and then putting forth our private information for anyone to get?
Yeah, I don't have anything to recommend in person live right now, but Lori, what I'd like to do, I do have some links that I would like to share with you, and maybe
Sure.
you can then push them out to the viewers in whatever mode you have available. There are a couple websites that answer this specific question, and then push you out to additional resources that are validated.
That is wonderful. So yeah, so if you're listening with us today and you registered, we're going to send those out as part of our follow-up with you guys. And we're also going to put them in our chat. So in YouTube or Facebook, with what Dr. Harper gets, we're going to get back out there. So we are past our half hour. Dr. Harper, thank you. This has been fabulous. So much I've learned, confirming that you can talk to your pharmacist. They are your go-to on medications, building that home pharmacy, and knowing you and empowering you is a right to know your medications, your family caregiver, and the pharmacist, what I take is your healthcare partner in your journey. That makes me feel good, right? It makes me, especially having my parents, my father is, 9 hours away, knowing that if I can establish that, that's a part of his care curriculum almost. So thank you. Any last minute words that we can offer our viewers at takeaways as we are all on a caregiving journey?
I just want to encourage what you just said. And, I've talked about being an advocate. I've talked about not concerning yourself with being a burden on the pharmacy and the pharmacy system. I can only speak for myself, but I think this is something that a lot of people in my profession experience, is that you can go through an 8, 10, 12-hour shift and just be slammed in a pharmacy and really be feeling down. And all it takes is that one patient at the very end of the day that comes in with a legitimate concern that they are struggling with, and you help them. And it makes the rest of the day just evaporate, because that's what we're here to do, is connect with people and provide that expertise to help them navigate this really, really challenging part of life. So every time that you're trying to advocate for yourself or your loved one and you're concerned about being that burden, just know that I, on the other side of the counter, may need that interaction with you to make my day just feel like it was worthwhile. And so you're helping me.
Yeah, I love it. All right. Well, thank you, Doctor. Your time and expertise has just been fantastic. And we could go for an hour on this one. And thank you to all the viewers that have been with us. Your questions on YouTube and Facebook are truly testament to why we continue to do health huddles in our collaboration with the Illinois Department of Public Health, because we want to deliver the experts who have all the knowledge, and we can be able to have these discussions and improve the quality of your life and those for your loved one. Again, always, if you have any questions or more virtual events, look to AARP. Also, for your health needs and questions about public health, look at your Department of Public Health and your medications. Talk to your local pharmacist. So, thank you, Dr. Harper. We appreciate you. Everyone listening, be safe and healthy, and we'll see you next time. Bye bye.